When you're having a postpartum hemorrhage or you're bleeding heavily after you deliver your baby, we do what's called a bimanual exam. Hey, I'm Dr. Allie. I'm a board-certified OBGYN. The common cause of a postpartum hemorrhage is what's called uterine atony. This is when your uterus is what we call boggy. It's kind of lazy and it's not doing its job. Typically what should occur after you deliver your baby is your uterus should contract down and cramp down to stop the progression of bleeding so that you don't hemorrhage or bleed out after you have a baby. Now with uterine atony, that means the uterus kind of gets lazy and forgets to do this. So it's boggy. We describe it as boggy because actual uterus itself feels like squishy and it's not tight and cramped down. Atony is seen in about 70 to 80% of cases of postpartum hemorrhage. Other common causes of a postpartum hemorrhage are things like lacerations or retained products. Let's say that me as an OBGYN, I just delivered this beautiful baby and I realize that the mother is starting to lose quite a bit of blood pretty quickly. The first thing I do a very quick physical exam. I want to make sure I don't see any lacerations. So we check it all. We check the vagina, the cervix, the perineum, the vulva. We're looking for lacerations, right? Because these can bleed significantly. The exam and I notice there's no lacerations. So my next thing is uterine atony accounts for 70 to 80% of cases of postpartum hemorrhage. So I'm going to do what's called a bimanual exam. Okay, so with a bimanual exam, I'm going to have one hand inside of the vagina and the other one at your belly. So picture this motion of hand inside of the vagina and then on the outside of the body right here, I'm going to have the top of your uterus or what's called the fundus, and I'm gonna gently feel, does the uterus feel boggy? Yes, then we have uterine atony and I need that uterus to clamp down. With the cervix and the lower uterine segment or that bottom segment of the uterus that I can feel in the vagina, I can have my hand around the fundus on the outside and I give a little massage. During this time too, with my fingers, I can feel if there's blood clots inside of the uterus. Because if there's blood clots or retained products, meaning parts of the placenta or anything like that inside of the uterus, we want to get those out because that can contribute to hemorrhage. During all of this too, I want to make sure I'm communicating with my team that we have enough IVs in place, that oxytocin is running or PIT is going, and obviously communicating with the patient and the family. Oftentimes, if it's a true postpartum hemorrhage where the patient's losing a significant amount of blood very, very quickly, which can happen, it can get very chaotic. A lot of people can run into the room. So I try and lead the room. And that means leading your team, your nurses, your techs, anesthesia if they're there, but also the family and the patient and making sure the baby's being safe, who has the newborn. So it's a lot of things that go around in your head and a lot of different moving pieces to control, but that's what we're trained to do. If you want more details? Let me know.